the agenda. Can you repost it or share it?
It's only one bill.
Right,
House
and it's House Bill 376.
Okay.
376. Okay, we are now streaming live. I'd like to welcome those who are attending virtually and in person, or in person virtually, to the health and to the Insurance and Pharmaceuticals Subcommittee of the Health and Government Operations Committee. And
376. It's okay. I got it.
We are here today to discuss a single bill, and the bill is House Bill 376, and it's health insurance diagnostic and supplemental examinations for breast cancer cost sharing. And Lisa, would you tell us what the bill does?
The bill prohibits carriers that provide coverage for diagnostic breast exams or a supplemental breast exam from imposing a copayment, coinsurance, or deductible requirement for the exams. The bill includes language intended to ensure the cost sharing prohibition does not conflict with federal requirements related to health savings account qualified high deductible health plans, and there are no amendments.
Okay. I don't believe the sponsor is here. For the benefit of those watching, we will let you know that this bill has gone through a study by the Maryland Healthcare Commission to determine what the ultimate impact would be on premiums overall. So, and that amount is 83 cents annually, about 7 cents a month. And what it does, it would provide for that, whenever there's a questionable mammogram, it would provide for the second diagnostic test to be done without cost sharing. So questions from the committee. Delegate Kaiser.
Thank you, Madam Chair. And I was just quickly looking at the fiscal note and its explanation. And I certainly am sympathetic to what this bill is trying to do, but I just want to make sure I understand, confirming really a simple question. If we're prohibiting copays for just certain procedures, I mean, because we all have copays for every other procedure we have. Was there I guess I wanted to know, are there other procedures we've excluded it for? And what was the rationale for excluding it just for this set of procedures?
We've done a set of, over the years, expanding our coverage. I'm not thinking of anything specific right now. Lisa, do you?
Well, we had the sterilization bill a couple of years ago.
Right.
On that one, we did the cost sharing, and that was where we first learned we needed to exempt the high deductible plans. I believe under the ACA, there's a certain number of preventative health measures. All of those are prohibited from having cost sharing as well.
Right.
I'd have to go back and look up other ones for sure. Off the top of my head, that's the one.
We do it judiciously, Delegate, but we have done it. And the sponsor is now here, the Speaker Pro Tem, Delegate Sample Hughes. It's still morning, right?
It is.
Delegate Kaiser was just asking if we've done this before in terms of, prohibiting a cost share on another procedure. And, we were responding with at least one that both Lisa and I could remember immediately.
Madam Chair, it wasn't the cost sharing question, it was the copay part.
That's
they go together.
Okay. Yes, it's simultaneously or used interchangeably. But to answer your question, yes, I think it was like 2016 or 2017 that we addressed the one dealing with 3D mammography versus 2D. And so we did the whole process as we did with this one, went through the MHCC to do the background research first to see what the impact would be. And then therefore, the year afterwards, then that's when we were able to introduce it and then pass the legislation. But I want to say it was like 2016.
Thank you for reminding of that. Yes, we did. Delegate Kipke.
Thank you, Madam Chairman. Lisa, can you help me understand who this bill will impact, what types of insurance, and then could you just verify that I understood you correctly? So if you have a high deductible plan that's exempt from this, in other words, you pay for the service and the testing, and that counts towards your deductible?
So the second part of your question for the high deductible plans, they are exempt with respect to deductibles after the enrollee has satisfied the minimum deductible rate, which, I mean, that was the we want to make sure that they'll be able to have their health savings accounts, and this language is there. That and then who it would apply to is, I believe, it's the large groups, but somebody can.
It's the individual and the individual large group.
That's it?
Yeah.
Thank you.
Well, and okay.
Any other questions? Anybody here in the room who would like to say something about this bill? Okay, seeing no hands.
Move the bill.
The bill has been moved. Do I have a second?
Second.
I have moved by Delegate Kipke, seconded by Delegate Johnson. All those in favor, please say aye.
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 Is there anyone who will be voting against this bill? Okay, seeing no one, it is unanimous. Thank you, Delegate Sample Hughes, for bringing us the bill and being patient through the year.
Absolutely. Thank you, Madam Chair.
And we will, with that concludes our business for today. And I wish you all a good afternoon. The Health and Government Operations Committee will convene at 1 o'clock today for bill hearings. Thank you all very much. And we'll see you
Thank you,
later.
Chair Collison.